You're watching WSTV Digital Media.
Good afternoon and welcome to the regular meeting briefing of the Forsyth County Board of Commissioners today. We begin the meeting today with a reminder to all citizens to participate in the 2020 census. It's vital that everyone in our community is counted. I'd point out before we begin as well that all of the commissioners are here in their places. We have some special people giving discussion items and important information for all of you. That would include Joseph Swift, who is the director of the Forsyth County Public Health Department, Dr. Christopher Ohl of Wake Forest Baptist Health. He is an expert on communicable diseases, and he will be here to give a report, followed by Chantel Robinson, who is Assistant County Manager, Victor Isler, and Denise Price, who represent the Department of Social Services, where a great deal of discussion and a great deal of work is going on. Before we begin the meeting with these folks, I'll turn the meeting over to Forsyth County Manager Dudley Watts.
Okay. Thank you, Mr. Chairman. Good afternoon, board members and staff and guests. Another virtual briefing today. A little unusual, but we hope it goes well. Really, I think you've done part of the introduction. The main part of the agenda for today is in terms of the presentations that really do revolve around the COVID-19 efforts that we have underway. I'll go ahead and turn it over to Joshua Swift, our Public Health Director, just to do his regular update. Joshua, are you there?
Yes, I'm here. Can everyone hear me?
I think we're good.
Chairman, Vice Chairman, Commissioners, thank you for allowing me to provide this update. First, I would like to thank the staff, the Department of Public Health, and the many partners who are working together to respond to the COVID-19 pandemic. Before I share our updated statistics, I need to say that the best way to prevent the spread of COVID-19 is for individuals to stay at home. As of 11 a.m. today, there are over 432,000 cases of COVID-19 and almost 15,000 deaths in the United States. There are 3,651 cases in North Carolina, with 65 deaths in the state. There are currently 113 positive cases in Forsyth County, with 61 cases having been resolved, and there have been 3 deaths. As of April 7th, 47% of Forsyth County cases are in persons under 45 years of age. We're concerned that young adults may have few symptoms or no symptoms and spread COVID-19 to those at highest risk. 27% of our cases are in individuals between 45 and 64 years of age, and 26% of cases are in persons 65 years of age and over. Our rate of cases per 100,000 is 28, compared to 31.8 across North Carolina. Once per week, we will release updated demographics on our cases. In our data, race and ethnicity is broken down in the following way. 14% of cases are African American, 4% Hispanic, 44% white, and 37% unknown. Unknown because the medical provider who requested the test did not complete that portion of the electronic order that was sent to the lab. Questions may still remain about the amount of testing. Testing is being performed by our hospitals and primary care providers in our community. Those with mild symptoms may not be tested that is a decision that is made by the healthcare provider. Priorities are given to high-risk populations, such as first responders, long-term care residents, healthcare workers, and older adults. Forsyth County Public Health only collects samples when requested or in conjunction with the state. Both hospital systems have information lines in place to handle questions and concerns regarding COVID-19 testing. We are continuing to work hand in hand with emergency management, local first responders, Winston-Salem Forsyth County School System, local colleges and universities, both hospital systems, and many other partners to ensure we are prepared and respond appropriately. I want to remind the public there are undiagnosed cases of COVID-19 since we have community transmission, and people may be transmitting the virus to others without knowing it. You must follow the stay-at-home order. Earlier this week, I spoke with the state epidemiologist, Dr. Zach Moore, and he believes the stay-at-home orders across the state are making a difference, but we can't let up. So Easter and Passover will be celebrated this weekend, and they traditionally involve large family and church gatherings. In addition, the warmer weather is enticing people to gather in groups. However, residents must remember that safety for themselves and their loved ones must come first. The COVID-19 virus can be deadly for seniors and for people with compromised immune systems, respiratory ailments, and underlying medical conditions. COVID-19 is highly contagious. People who are infected can have the virus for days without showing symptoms, and some will never have symptoms. You could feel fine and yet be bringing COVID-19 into your home and to your loved ones without knowing it. So in closing, this weekend is meant to be a time for some to celebrate faith and family. And if you must go out for an essential reason, please adjust your plans so that you keep yourself and your loved ones safe. Thank you for your time.
Thank you, Joshua. Appreciate the that great report. Why don't we go ahead and go and hear from our second speaker, and then we can come back for questions. Over the last several weeks, I have appreciated our contract with Wake Forest Health Sciences and the hospital more than I ever have. They provide medical direction for the public health department, and we are lucky in that contract to have a number of physicians and a number of specialties that provide services that do the work of the public health department, and so we are really appreciative of that. I know Joshua would acknowledge that as well. Obviously, a person who's been very key in that role has been Dr. Christopher Ohl, and Dr. Ohl has actually helped us through this process really to try to make good decisions around the management of the county in terms of what services we continue to provide and what we close. And really just guidance across all of that. So it's been absolutely essential through that whole process. And so I just want to thank Dr. Ohl for that help and for him being so open and readily accessible to all of us. So anyway, if I could just turn it over to Dr. Ohl, I thought what we would do today is really get kind of an update from the medical side. And Dr. Ohl, thank you for being with us today, and I'll turn it over to you. Are you there?
Yeah, I'm here. Can you hear me okay?
We can. Thank you for being
all right. Sounds great. So I wanted to point out a few things, and I think as influential members of our community and our county government, I think that you should know that some of this pain that we call social distancing and sheltering in place is working. Last week I said, I really think it's working. This week I say it is working, period. If you look at the epi curves from not only North Carolina as a whole, but also the Triad region or just individual counties, we have flattened the curve. People ask me, okay, well, when are we going to peak? And I said, well, to have a peak, you have to have a mountain, and we're more on a mesa, those big, wide, kind of high areas that you see out west, and that's good because that means that our healthcare facilities and our other services that we provide in healthcare and government are not being overwhelmed, and our cases of COVID are manageable, and also our other patients that may not have COVID but need medical care, and we can manage them in somewhat of a usual way of doing business. And that means we have controlled the outbreak to some extent, and this is all a result of our shelter in place and social distancing. So with that, there's been some models, and you may have been seen these in other venues about what happens to our MESA if and when we release our shelter in place, and if we do it all at once. And it's pretty clear, and these come from epidemiologists and infectious disease people from North Carolina. So it's not designed for another state. This is North Carolina. But our MESA, this kind of plateau that we're on, will start to increase and go up, and we will start having to climb the mountain. Particularly if we release our social distancing and sheltering in places sometime around the end of this month or the beginning of May. And that increase would be enough so that 50% or so probability that our intensive care areas in our healthcare systems would be overwhelmed and have resource shortages, either in beds or ventilators or PPE or what have you. If we don't release sheltering in place and social distancing at the end of this month, and we extend it towards the end of May, and then release it in a more controlled way. It's kind of like going skiing. You don't want to go skiing down the slope in an uncontrolled way. You want to be able to control how you come down. But if we wait until the end of May and come down in a more controlled way over 2 to 3 weeks, then we don't see that increase or surge in cases and not nearly as much of a probability of overwhelming our healthcare system. So when you're on a MESA, the good news is that you're not being overwhelmed and you can kind of manage things. The bad news is that MESAs tend to go on longer than a mountain. But I think most of us would say that we would rather be doing this like we're doing this here now in our region rather than doing it like New York or New Orleans or Detroit where everything is kind of overwhelmed and more chaotic. So that's a little bit about the epidemiology. So I think we're going to have some decisions to make as we get into the end of the month because they're competing interests. If you talk to Mr. Swift or you ask me or you talk to Kevin High or Julie Freischlag, our CEO, or anyone involved in healthcare, they'll say extend our distancing and sheltering in place out as we get into May and in mid-May, do it and release it in a controlled way. But if you talk to people who really need the economics and would like to see businesses up and usual and our lives back to normal, they may have different opinions on that. So there's going to be some discussions and how to do this, and more to come on that. I also wanted to thank each and every one of you in helping keep the essential services in our county going, and also outdoor recreational services. This is really important because if people don't have places to walk and bike and play tennis, and ride a horse at Tanglewood, so on and so forth, then if they don't have that outlet, they're going to go do it on their own, and they're more likely to do it in an unsafe way, and getting together, neighborhood parties and backyard barbecues, things like that. And as Jonathan said, that's not what we want our citizens doing right now. We want our citizens to be doing their social distancing. So if people have safe recreation available to them, it'll keep our citizens in Forsyth County safe than by doing it and just shutting everything down. Plus, also you have to think about all of the other services that are provided in the county and how they affect vulnerable people and our safety nets for the well-beings of our citizens, and those just need to keep going. We can't stop doing the usual things that we do to keep our citizens safe and healthy just because of COVID. So I really applaud all of you for helping with that. And our city manager, our county manager has done a fabulous job. Our city manager has too, but that's a whole different group of people to talk to. So what is going to be our exit strategy from all of this? Well, I think when we do get away from sheltering in place, hopefully in a controlled and gradual way, that we will be going back into a more of a containment model again of using our greater testing resources to identify cases and then to quarantine those who have been in contact with those cases and isolate the people who are sick and try to build a cocoon around infected people. And that's going to take resources, and I applaud our health department has done a phenomenal job throughout early containment, now mitigation, but when we start to come down off the mesa, their job's only going to get harder. And we need to do everything we can to support them, because going back into a containment mode takes a lot of time and resources to test and identify and then quarantine people. There'll also be a need for a big public campaign to help make sure that people who are identified and put in isolation, and that the people around them who are in quarantine stay that way for the time, and that they don't break those quarantines. Some countries do their quarantine different. They basically forcibly remove people from their homes and put them in camp. I don't see that happening in the United States. I don't think, personally, I don't think that needs to happen. But we're going to really have to work with people to do their quarantine in isolation. And that'll be a big community mess. I get asked a lot, is going to be another wave of this? If once we get over this wave, will there be another one in the future? I think, it's a little bit, my crystal ball gets a little fuzzier the further out we go, a little smokier in there. And then maybe yes, this fall, there could be a second wave. And so we'll have to continue to think about that and prepare for that, be ready. We will be more prepared for a second wave than we were for this. And then lastly, just briefly, we are having more testing capabilities in the hospitals here in our region, including our own here, and our turnaround times are increasing. By the end of next week or the week after that, we would be, we'll even have more. And so I think by the time we get to the end of the month, testing is going to be much less of a critical resource need. And more of a help. And we are also in healthcare staying ahead of the PPE game, for us anyway, in hospitals. And I know Jonathan's worked real hard to get the PPE and the personal protective equipment for his staff and people. And it remains a challenge. I'm sure he'll tell you that too. But we need to keep on top of that. And hopefully as time goes on, that'll get better too. So with that, I think I'll go ahead and end my remarks. We can take questions later or whatever you think would be best.
Thank you, Dr. Earl. Actually, I think now's a good time. Questions can either come to you or Joshua. And so I'll just open it up. And if anybody wants to ask a question, I think it pops up on my screen and I can see Ms. Wisenhunt. I can see you there. So I'll turn it over to you.
Thank you so much. And thank you for this update. It was great. Could you give us your opinion on wearing a mask? I think that the citizens are very confused. We hear different opinions each day. Could you enlighten us on what your opinion is?
Sure. So, and Joshua, speak up too with your thoughts. But the masking issue came about a couple weeks ago because there was some concern that asymptomatic or even more likely what we call pre-symptomatic. In other words, people who haven't quite thinking they're feeling sick yet might be shedding virus. And the way they do this is in droplets. And so the theory would go is that if you put a mask on somebody or cover their mouth or a bandana or anything, cloth or whatever, that you would catch those droplets and then they wouldn't get into the surrounding areas and less likely to contaminate surfaces and things. I think the masking thing is probably a bigger deal for those areas that have more widespread community transmission. Here in Forsyth County, I think our transmission is probably a little bit more on the minimal side of things, minimal to moderate, and not widespread. And then also, I think the masking is more important when you can't do the social distancing. So if you think about it, there's some grocery stores you go to, and you and the other 6 people in the building are shopping for groceries, and you're lucky to even see each other. But then, for instance, going to Costco on a Saturday afternoon, it's sometimes a little hard to keep your 6 feet away from people. And those are settings where masking would be more important. And you don't need to wear a mask outside, really. There's so many exchanges of air, and transmission is so unlikely that if you don't need it. So it's mostly in the buildings where that tend to be a little bit more crowded people. But it's hard to put that message out to people in a way that black and white, because it's a little bit more gray in reality. But I think some people feel more comfortable with it on, and that's fine. Some people feel more comfortable with it off, and as long as they're not sick and they can keep their distance, then it's probably not an issue.
Okay, thank you. No, there's a question from Commissioner McDaniel.
I apologize. Thank you, Deputy Manager Dudley. One of the questions, first I wanted to say thank you, Dr. Orr, for that great advice that you gave for the community. And those were some of the reservations that I had with regards to the holidays coming before us now. And now we have some marching orders to wear our mask and stay safe. Joshua, I wanted to say thank you also for that report. I appreciate you providing the numbers with 100 and I think you said 13 positive cases, 61 being resolved, which is absolutely wonderful, and the 3 deaths, and we give condolences to those families as well. Looking at the data that you gave regarding those numbers for the ages and the ethnicities, if we could, you don't have to do this today. We want to just continue to drill down those statistics and that data. So of the data that we've received with regards to African Americans being at 14%, the Hispanics at 4%, 44% for the Caucasians, and 34% unknown. If it's possible, you don't have to report this, but if you can send a report to me so that I could help our community understand that there should not be too much anxiety if we just follow the stay-at-home order. So the question again the ask would be for us to drill down those percentages of ethnicities to find out the age range within those ethnicities. I think that would be somewhat helpful moving forward. So thank you.
Okay. Yeah, thank you, Commissioner McDaniel, and we will continue to refine these statistics as best as we can. Some of it is because of the information that we're given, because of the way the testing is being done and what the medical providers, that information they provided. But we are, as you said, we sent this information out first yesterday regarding the age and the racial makeup, just so we can educate the public, but also try to calm some fears in the area.
It's very helpful. We can assure our community that we are utilizing the resources that we are providing by way of federal, state, and local governments in those particular areas with regards to and again, those resources. So thank you.
Yeah, I would like to echo what Joshua said, that this is really an important area because healthcare disparities have to be examined and met and really tackled at every venue for every disease, and COVID-19 is no different. And we really do need to know the data and why. And as Joshua knows, there's a lot of challenges because with all these cases from the hospitals that we're testing, and some of that data just doesn't exist at all. So our best data comes from public health, and then you have to realize that identified cases have a lot to do with access to health care. So we'll really need to work hard and make sure that we take care of all of our people as time goes on.
Question, Mr. Chairman.
Yes, sir, Commissioner Elney.
Yeah, just a comment first. I've been doing a little conference call with some of the national organizations around the same issue of how the various races have been impacted, especially with the death toll. Last night I was on a national call with the NAACP and others, including Nancy Pelosi, and they were saying there's an average of 42% of the deaths nationally been done in the African American community as a result of this major issue before us. But one of the problems with the data collection is that the CDC is not requiring that in their database to identify the racial identity of the persons that are coming to them. So that's going to have to be adjusted so we'll have a more accurate account of what's really going on. Illinois had a 7% toll of deaths among African Americans as a result of this major issue before us. And there were even worse ones in New Jersey, but there's no national database being collected to give us the kind of support that we need. So we may want to influence that level of research to the greatest ability as we can through our centers, et cetera, to make sure they're collecting the right data, because we need to be very transparent on who's really impacted the most with this virus in front of us at this point.
Yeah, I couldn't agree more. I don't know what to say about that, but some of the issues with the data collection early on is and not to get really into too many details, but normally when we have communicable diseases, when you test for the disease, you have to submit a data form with it that goes to the CDC through Joshua's shop and then to the state and then to the CDC. Because of the testing problem and the shortage of tests and the need to get them done, the state lab was accepting incomplete PUI forms, so the doctor may have left a lot of it blank. It was just submitted it because we needed the test result badly. But as time goes on, that's just not the issue anymore. So as you say, we really this is an area where we really have to get the data and look at it. And healthcare disparities in any area, just as far as I'm concerned, just really shouldn't be tolerated, and we need to do everything we can to eliminate.
And I would, this is Joshua, I would just add, just as Dr. Oles said, I believe that going forward, the data and statistics that we get will be better and better able to identify the demographics and looking at trends. And I agree that unfortunately we have health disparities before COVID-19, and we have and we may be seeing those in other areas of the country and of the state. Right now, from the data that we have, it doesn't appear, but as Dr. Oles said, those early tests that came through, where normally with public health and communicable disease, there's strict forms and that have to be put in place. But since this was different, the state lab was accepting incomplete information just so they could do the test as quickly as possible.
Can I make one sort of, this is kind of to Dudley perhaps. I appreciate the the decision about the parks. I mean, I think having that open air and having an outlet for people to go is really good. And my question becomes, it gets into exactly what we're trying to prevent, which is maintaining social distancing, and whether the groups, I don't know if it's a magic number, but 10 or more. I could see a large number of people deciding to go to a park to play volleyball, or a large group to go to do whatever it is at the park. And we end up with a lot of, if you will, violations of social distancing. And clearly we don't have the capacity to monitor that. And I'm kind of wondering what the thinking is about that.
Yeah, so I might ask Damon to weigh in on this. Damon, do you want to share some of the direction you and the parks leadership have talked about?
Sure. So at this point, we've removed the volleyball nets, we've removed the rims, we've locked some facilities. Now Tanglewood and some other parks may be busier on the weekend, but in my visits to Tanglewood and some of the other parks, it's really the walking trails, and people are basically in their family groups and trying to comply with social distancing and mass gathering for the most part. Where the struggle's been has been at organized sport facilities, kind of like a basketball court, which is why we took the rims down, or volleyball where teams are playing. So that's why we took the volleyball nets down. So we're trying to anticipate that, but we'll have to be vigilant and actually watch it and disperse groups that are not complying.
And I would add, we do have staff on site that are really geared around and directed to, if you see something that's just not healthy, we'll take action to close part of a facility or whatever. As Damon mentioned, we've debated over the dog parks through this, and actually had gotten advice from Dr. Ohl on sort of how that is. As long as everybody will maintain social distancing, we haven't felt like we've needed to shut them down, but park staff is sort of directed to take action as necessary if we start seeing a problem. We've got a few phone calls and really gone out and taken a look and made decisions about what to close down and what not to. Is that
Joshua?
Yeah, thank you.
I have a question.
Yes, sir.
When the commissioners did what we did regarding stay at home, we put a date on it, April 17th, that's next week. So the question is, we put that down for a 2-week run, and I've heard a number of people, both in New York and Washington and all over, and in the media, saying that, well, once we get that line flattened, then we can begin to operate. Well, the problem I see right now is April 17th is coming up. But Joshua, I heard you say a moment ago that the line is beginning to flatten. So what happens if April 17th comes up? Do we amend that and extend it?
Well, I would, use Dr. Ohl's analogy of we're on the mesa or the plateau. So we're at a higher level of cases, obviously, but we haven't hit a peak, and sometimes this mesa or plateau goes on for a long time. Just what we're hearing from the State Division of Public Health is you have to be systematic in and how you do this. We didn't get here overnight into our situation as far as ramping up these orders, and we shouldn't let them go back to normal all at once. It has to be systematic. I would say we should look at possibly what guidance is coming out from the Division of Public Health and the governor's office. We've been waiting to hear from the governor, thinking that the stay-at-home order would be extended, but we haven't heard anything official this week. I do think the fact is that it is working, and I'd shift this over to Dr. Ohl. But I think if we went back to normal tomorrow, I think our cases would possibly go up. I don't know how he feels.
Yeah, I wouldn't say possibly go up. I'd say they skyrocket right now, and so we're not going to be ready to to lift it on the 17th of April. And I'm not going to put words in the governor's mouth because it's going to be, his guidance is obviously going to be important, and he has other things to think about. But I can tell you that every single healthcare provider, hospital CEO, chief medical officer in North Carolina is going to give him advice to continue it in place, because otherwise everything we've done will be for naught.
Mm-hmm. Yeah, what I would add is the governor's order extends through the end of April, so we're certainly under that. I've been in discussions with the city manager, and my understanding is the mayor's going to be in touch with you, Mr. Chairman. He's looking for an extension, and I don't want to say exactly how long or how far out it is, but they will be making that decision next week, and we'll be asked to sort of act in tandem with that. So I think that definitely an extension. Well, even if the local order dropped, we'd be under the state order through the end of the month. There are some differences in that. I think there'll be real benefit in leaving our local stay-at-home ordinance. It seems to be fairly well accepted by the community. They know what the rules are for the most part, and so we'll just be trying to work in conjunction with the city of Winston-Salem in that, and then the other towns for the most part have really followed that lead.
I'm glad to hear that, because a lot of folks are under the impression that the magic day will be April 16th or 17th and everything will end that day, and that's not the case.
Right. Very good. Are there any other additional questions for Dr. Ohl or Joshua? Dr. Martin?
Just one. And it really gets at the comment that was made earlier by Dr. Ohl about as we begin to reach a point that we gradually begin to lift restrictions. No one has done it yet, and so there's no experience out there it's conjecture, but I'm just trying to envision a gradual sort of loosening of restrictions, and I guess in my own mind I see it probably starts with probably a lot of the personal service businesses that were closed, from the beauty salons and the gyms and the massage parlors and the tattoo parlors and the this and the this and this and this. Those that have so much personal contact, that probably makes sense maybe to be last. I don't know. And maybe some of the other retail stores, if they maintain social distancing inside, the ones that are non-essential might be in the first group. I'm just kind of, and I think the public obviously is very interested in knowing what the way out begins to look like.
Yeah.
And so I think just some speculation. Magic answer to this, but I'm just curious.
Yeah. Well, when you come up with the magic answer, let me know. Because it's a lot of people are thinking about this, but it goes right along the general directions that you're talking about. I mean, certain things are riskier than others, and then also, I can tell you that I think the real heroes through all of this shelter in place have really been our kids. And it's really affected them a lot. And so, particularly if there's areas where kids can become a little bit more normal in a safe way, that would be an area where we could go first. I've been thinking a lot about, community swimming pools and HOAs. Is there a way to do that in a safe way? Because, the pool itself is the problem with the water. It's all the social interactions on the deck. So is there a way to limit the number of people and open it in a way? And I think here, for the county aspects, we've decided to push it back some. And so maybe it won't be as an issue as we get into June. But you're right. That's the way to think about it. And you do your less risky things and open that up first. I really feel for a lot of our local businesses, I see like one business that's considered essential, and then next door a business that's not. and the business next door, you know, probably could social distance and do things in a safe way just as well as the essential ones. So I think those will be the things that'll be looked at. But I'm not the ultimate decision maker on that. I think a lot of that direction is going to come from the state, but there'll be roles for local interpretation and influence. So I'm standing by to help everyone figure out what the riskier ones are and the less riskier ones are. So I'm looking forward to that day, actually.
Thanks for the reports.
Thank you. Any other questions for Dr. Ohl? And if not, Dr. Ohl, I know the entire board appreciates everything that you do for us, and what you've done now and what you've done normally in what's normal operations in the communicable disease work that you do with our public health department. We are lucky to have you, and thank you so much.
Thank you very much. And I'm really lucky to have a fantastic county public health department, and Joshua's great leadership. So accolades to all.
Now, can I ask Dr. Ohl one more question, please, before he leaves?
Sure.
Dr. Ohl, our last presenter from Novant indicated there had been 60 patients that come through to be either develop a plan for them in terms of this virus and or they would check for it. Do you know what the numbers might be more recently in terms of patients going through Novant and or Baptist?
Well, right now we're really only testing people who are inpatients. They're going to be admitted or for healthcare workers. And so we haven't been keeping track of the outpatient numbers quite as closely because most of those people go home to convalesce on their own for their 7 days. So I don't know that info. I can get you the inpatient data. I don't have it in front of me right now, but it's steady. It isn't changing much from day to day. I mean, we average in our facility between 3 to 5 admissions per day, maybe 2 to 5, something like that. And it hasn't changed for a week and a half.
Well, thank you very much. And thank you for your report as well, Dr. Ohl.
Okay, very good. Again, thank you. The other report and kind of presentation that we wanted to make today really deals with some of the COVID-19 response, particularly around a multidisciplinary, multi-institutional team that was put together 3 or 4 weeks ago, and Chantel Robinson has really helped lead that. So I'll just turn it over to Chantel to talk about the work around homelessness.
Thank you, Mr. Manager, and good afternoon, Commissioners. A coordinated effort between Forsyth County, City of Winston-Salem, and Continuum of Care members has been established to address the needs of the homeless population during the COVID-19 pandemic. This team convenes at least twice weekly to ensure maximum leverage of resources and sharing of critical information. The county is leading the efforts as it relates to homeless individuals who test positive for COVID-19, are symptomatic, pending testing, have known contact, or are discharged from the hospital due to COVID-19. We are working to house these individuals in hotels or motels with monitoring via medical and community-based support. In addition, public health staff has visited with local shelter programs and are providing technical assistance and CDC guidance. Our Social Services Director, Victor Isler, and Assistant Public Health Director, Denise Price, are leading the county's efforts and are working tirelessly to coordinate and collaborate with both internal and external stakeholders. I want to publicly thank them and their teams for their hard work and dedication. I have asked both Mr. Isler and Ms. Price to provide you with more details regarding the coordinated efforts that are occurring. Mr. Isler, Ms. Price.
Yes, thank you, Ms. Robinson. Definitely, as our Assistant County Manager, Chantel Robinson, stated, we are making diligent efforts around securing a site for those that are impacted by COVID-19. Please note that we are still in contract negotiations with one hotel site. We are excited about being able to leverage that and to be able to close that out, hopefully by the 1st of next week. The other piece of it is I do want to say thank you to our attorney's office for working diligently in working through the terms of this contract. Please know that this is new business for hotels and motels. Nationally, hotel motel providers and businesses are consulting with each other around this. And so it has been a heavy lift. And I do want to thank Denise Price for championing that process and the consultation with this hotel provider. The other piece to this is that screening for medical necessity is something that is critical for us. We want to make sure that our homeless population is screened well. And so we are working with public health and also community medical providers to leverage that, and mobile integrative health is assisting with that as well. Also, please note that we have to build out the capacity to do this screening and testing to be 24/7 to make sure that we can respond to the shelters as individuals come up Monday through Friday, also on the weekends. We also recognize that the wraparound support services are being leveraged at this point in time. We do have the food provision secured. We are also working through our biohazard cleaning service provision as well. And last but not least, our medical rounding is coming together also. Last but not least, we are in active conversation with the COC weekly and also daily with the division directors for those shelters as it relates to the 24/7 intake service process, and also helping them create decision-making trees and also a triage process for those that may be impacted. And so we are moving rapidly with this, and I just want to say thank you for your time and support. Denise Price, do you have anything you want to add?
Thank you. Yes, I'd like to share with you a little bit more information about the work we've done with the shelters directly. Public Health has created teams to be assigned to the shelters, so they always have a point of contact and someone they can reach out to if they need assistance. These teams, we have two of them, are comprised of both a nurse and a public health educator. Although I meet the criteria of neither, I did have the fortune to be able to go out on that first visit to Samaritan Ministry, and I can tell you that it was pretty impressive what they had put together by reading through the CDC website, trying to leverage as much as they could out of the space that they had to maximize the amount of services that they were providing and also be respectful of social distancing. There was a learning opportunity for public health, and I think that the shelter would agree with me. It was a learning opportunity for them as well. We were able to offer some suggestions and some guidance, and also got some ideas, some additional needs that they might have so that we could help them to fill in those gaps. Additionally, they've asked for environmental health to do some education around cleaning, and that is in the process of occurring. Probably the most important takeaway to know is that folks do now have a point of contact that they can reach out to, know that they can get a familiar person on the phone and receive the guidance that they need. Thank you.
Thank you, Denise. And in closing, please note that we are still building this process out, but also serving individuals that fit into this category. And so at this point in time, we are serving citizens in Forsyth County.
So we're happy to answer any questions.
Yeah, Chantel, I was just going to ask you to add, while we're taking the lead on the folks coming out of the hospital or COVID-19 positive, the city's really taking the lead on the other groups. You might want to talk just a little bit about that.
Sure. So the city is taking the lead on the medically fragile population. And actually, I'll let Victor kind of give you a little more details because him and Denise have really collaborated with them a lot on that.
Thank you, Ms. Robinson. Definitely, there is an arm of this as it relates to the medically fragile. At this point in time, that consists of around 160 individuals. We are in daily consultation with the COC. They have been working with public health based on the CDC guidelines to identify those that are medically fragile, screen those, and also have a roster of individuals. At this point in time, some of the shelters have been able to make the provision within their shelter operations for those individuals to isolate, which is a good thing. However, plans are being made for about 60 individuals via a proposal to look at hotel and moteling them based on the lack of capacity within the shelter process for those individuals to have separate spaces. And so at this point, I know site visits have taken place today to look at where those medically fragile individuals can actually lodge during the time frame of the pandemic.
And that would be managed and basically administered by the city, I understand.
Correct.
And so the city will take the lead on those efforts, but the county is certainly, social services as well as public health is there for technical assistance and guidance. We may possibly utilize community paramedics to assist with any medical triage that may be needed. But in terms of the hoteling, moteling, the city is taking the lead on that endeavor.
Any questions for Chantel, Denise, or Victor?
One question, Dudley. Do we have a number of people that we have housed coming out of the hospitals to date?
So, Commissioner Elamine, the challenge with that is due to HIPAA rights. We really cannot say how many homeless individuals test positive for COVID-19. Because that is really a small subsection. But what we can say is that if anyone meets the criteria, if they test positive for COVID-19, if they're symptomatic or pending a test or have no contact, we are housing those individuals even now today.
Okay. Thank you.
You're welcome.
Okay. So any other questions or comments around the COVID-19 work? I'll kind of wrap that up, then I'll get on to the other part of the briefing agenda for today. Any questions, comments? Okay. All right. There we go. All right, very good. So the only other two items that we really had for today, one is just to finalize this agenda for next Thursday's formal meeting. That's the April 16th meeting of the Board of County Commissioners. We did have a discussion item, which is the kind of the routine Cardinal quarterly report. Since we've heard from folks already kind of outside that briefing session, why don't I go ahead and turn it over to Reed Thornburg. He's with Cardinal Innovations for his quarterly report. We'll go ahead and do that. And then the last item of business would just be reviewing that agenda to finalize it. So Reed, are you on the call?
I am. Can everyone hear me?
There you go. We can not only hear you, we can see.
Thank you. Thank you, County Manager, Commission Chair, Commissioners, and County leadership. I'd like to start off by saying a special appreciation for the healthcare providers, first responders, and direct caregivers in Forsyth County and surrounding who, on a day-to-day basis, put themselves and their families in harm's way and at risk, not only outside of a pandemic, but during the current one. And so thank you personally and on behalf of Cardinal Innovations Healthcare. Thank you for your collaborations and the work that you do in our communities. What I've provided to county administration and has been forwarded to the board is the quarterly update for the third quarter for the fiscal year, which would be January through March of 2020. And so you'll see that I've provided some organizational updates that just touch on the fact that our regional health council and our community advisory councils are up and running and have been started. Thank you for your efforts in reviewing the community advisory council applications and your approval of those for us to go forward with holding the community advisory council. The mental health, substance use disorder, and IDD advisory boards continue to meet on a monthly basis and are continuing to disperse the county funding that you provide through those advisory boards to community agencies and special initiatives in the community for financial support to continue their efforts. Also, within the past quarter, I know that your county manager, your assistant county manager, your DSS director have had an opportunity to talk with the Cardinal Innovations Healthcare executive leadership, our CEO, COO and myself, and to collaborate on constructive feedback and information necessary for Cardinal Innovations Healthcare to understand the needs of Forsyth County, and in particular, the services provided to individuals who are served through county departments, and in particular, the Department of Social Services. For COVID-19 response and wellness, Cardinal Innovations has taken a proactive stance on trying to support our counties, all 20 counties, including Forsyth County, in a relief fund that's been established. Currently, those applications are being submitted online and are being reviewed by an internal committee for approval and payout of up to $20,000 per request that is approved. Also want to let you know that even though our physical facilities, which includes the Highland Avenue Wellness Center, has been closed temporarily and services suspended directly there face-to-face, we have continued to offer wellness programming through virtual media platforms and formats, which includes everything from virtual support groups to the wellness activities, which are typically provided there on site, are now available through our Facebook page for members and individuals and families in the community to continue to participate, just not face-to-face. We've also continued to coordinate efforts with homeless shelters, group homes, and healthcare providers to address service needs and emotional supports, including collaboration with the Department of Health and Human Services, as well as our LME MCO partners across the state, to develop efforts consistent to support individuals in our communities. I've also provided some information portals which will give you the most up-to-date and current information that we're providing to communities and to members being served. Just to highlight one of the efforts that is ongoing is the Triad Foster Care Pilot, which your DSS director has been very involved in recent months. The Triad team, DSS and Cardinal Innovations, has been joined by the Department of Health and Human Services, University of North Carolina at Greensboro, and the Division of Mental Health, DD and SAS representatives to explore a plan that could potentially utilize Governor's Task Force funding to develop a success team and startup of a high-fidelity wraparound team. The local team has been meeting at least monthly to discuss those efforts and the outcomes of some counties in North Carolina who are currently implementing a success coach model, as well as a tiered care management model to support children and youth in child welfare and addressing the traumatic experiences, the trauma needs, the emotional needs of those children and youth. The state is currently in the process of developing a specialized Medicaid plan, which is part of a Medicaid transformation that you may be well aware of to address the needs of children and youth in foster care. And there is a potential that this joint effort that's happening in the Triad could have an impact in recognition of our efforts in that statewide plan that will be specifically addressing the needs of children and youth in foster care who are part of that Medicaid plan. And you've also, I've provided as well to county management the second quarter dashboard reporting, as well as information pertaining to the maintenance of effort funding through, I believe, mid-February as well. Thank you.
Okay. Any questions for Mr. Thornburg? Okay. Thank you for your report. Appreciate you being here today.
I couldn't get my mic off. I have one question for Reed, particularly is regarding the Highland Avenue Center. I guess I did, if I understood you correctly, you said it was closed, and I'm thinking about those X number, whatever it was, 15, 19, 12 chairs that we had for 24/7, really 23-hour review. Our own research showed that reduced and diverted folks from the emergency room very successfully. And so what that's telling me, mental health issues have not ceased during the COVID virus, the COVID-19 virus issue. That tells me that those folks are now going to the emergency room. I'm kind of curious about why we cannot safely operate that portion. I've actually seen visited the facility, and the chairs are pretty far apart, and obviously medical mask, et cetera, could be working, because it seems to me those folks are going to go right into the emergency rooms in our hospital.
So thank you for your inquiry. The wellness center that I was referring to, the Highland Center is our wellness center, the Cardinal Innovations.
I understand the wellness part. I'm sorry to interrupt you. And I understand the online part. Are you telling me that you don't operate the other part? Is that what you're getting ready to tell me?
Daymark Recovery Services is still operating.
And it's open?
Yes, they're operating services. Yes, sir.
Thanks. I did short, so you don't have to.
No, sorry for the confusion. Yes, it's just the wellness center that Cardinal operates there on the corner.
Got it.
Of the building.
Okay. All right. Any other questions for Mr. Thornburg? Great. Thank you. Appreciate you making time for us today.
Thank you.
All right. So the only other item is just finalizing the agenda for the April 16th meeting. Mr. Chairman, I'll just run through it fairly quickly, and we'll get any questions we have answered. So hopefully you have that in front of you. The first item is the public session. The second item is an amendment to the 2018 Motive Equipment Replacement Capital Projects Ordinance to appropriate insurance proceeds and a general fund transfer for the vehicle purchase. There it is. It's on the screen. Great. Christopher Ong at our budget office reviewed that. Any questions? Okay. Item 3 is an amendment to the fiscal year 2019-2020 budget ordinance. It appropriates additional low-income energy assistance program funding. Kyle Wolf with budget reviewed that. Questions? Okay. Item 4 is an amendment to the State Public School Building Capital Fund Grant Project Ordinance. From fiscal 19, it closes 2013 and 2015 school bond debt service projects, and it was all issues arising from the 2006 school construction bonds. Any questions on that? Okay. Item 5 has 2 parts. It's a resolution ratifying and authorizing a joint application by Forsyth County and Winston-Salem Forsyth County Schools for $3,952,737 from the Public School Building Capital Fund, which is the Education Lottery Fund, and it retires a portion of the county's school bond indebtedness. And you've got an associated amendment to the State Public School Building Capital Fund Grant Project Ordinance. That's that action the board takes every year, essentially, to get that education lottery money there to pay the debt service. Any questions? Okay. Item 6 is an amendment to the 2017 court facility CPO. It appropriates $101,000 of interest earnings for debt issuance costs related to that 2019 court facilities installment financing agreement. And that's actually related to the item 7, which is the amendment to the fiscal year 2019-2020 Capital Reserve Fund to appropriate refunding bond proceeds for debt issuance costs related to the 2020 general obligation refunding bonds issuance. So those 2 items are similar. Any questions? Okay. Item 8 is an amendment to the 2019-2020 Debt Service Fund to appropriate refunding bond proceeds for the redemption of callable bonds from the 2010A and 2010C general obligation bonds and for debt issuance costs related to the 2020 general obligation refunding bond issuance. Questions? Okay. Item 9 is a resolution authorizing approval of the Forsyth County Emergency Services participation in the Emergency Triage, Treat, and Transport model program, which is also called ET3. It authorizes execution of an agreement with the Centers for Medicaid and Medicare Services and Emergency Services. Submitted that. Questions? Okay. Item 10 is a resolution awarding a contract for the purchase of a law enforcement detention center specialized mail screening system. That there were some questions about that. There was a memo sent out by Randy Hunsucker, the Sheriff's Business Officer between last Thursday and now. You should have received that. It answered some of the questions that were out there, but I believe I saw Randy on the call. He's available if anybody has any further questions.
This is Don. I have a couple. No surprise, perhaps. I did read the memo that I received from Randy. It was helpful. Although I noticed that one of the users had the equipment for 1 month. I did just happen to go on to just put in my browser online. I put in mail screening devices. And what popped up were about 6 or 8 vendors that actually provide that service. And I remember in your initial presentation about this equipment that the RFP was sent out and there was only one bidder, and this company was so specialized. Well, I just saw 6 that popped up on the internet that are in this business. So I'm curious where the RFP for this equipment came from. Did it come from the company that that you are recommending we buy it from?
Randy, I believe your mic's on. You're going to need to unmute your mic.
We actually did the same Google search that you did, and when City County Purchasing sent these specifications out, that company was the only one. And what we believe is the difference is all the other companies, they have mail screening systems, but they're not instantaneous, and they don't screen for the drugs that we are looking for, the cutting agents, so they did not meet the specifications for those reasons. But we did send it out to those same ones that you probably saw in Google search as well.
Do you happen to know how many years this company has been in existence? Because apparently their sales numbers are actually, they're a very small company with, I don't know, $6 or $7 million worth of sales. And that strikes me as a new company, potentially unreliable, a lot of built-in costs, and unless you, at this point, I'm a no vote. It may pass, but I'm definitely not going to vote unless you can tell me something that makes me more confident in this piece of equipment.
All we can say is we surveyed, we sent out a sort of shotgun approach to several jurisdictions that we heard had one. Only three responded back so far, and all of them liked it and seemed to say it worked.
Yes, but my question is, how large a company are we talking about, and what are their volume of sales, and how long they've been in business?
Yes, I believe I've heard that in passing as well. When I called the vendor to ask a follow-up question on their bid, he did mention in passing that they are a small business. But beyond that, I don't know how long they've been in business. He did say this particular product has only been on the market 5 to 6 years. That would seem to support what you're saying, that they are fairly new and they are a small business. Yes.
Okay, I have no further questions.
Chairman?
Yes, ma'am.
This is Commissioner Tanya McDaniel. I wanted to say, Randy, thank you for doing your diligence surrounding the research. And I do trust the research that you have provided. And, you know, I guess the role and responsibility is to ensure that we have the safety of the employees at the Sheriff's Department, and also to ensure you're safeguarding our visitors at the jail as well. Thank you.
Any additional questions for Randy? All right. Thank you, Randy. Agenda item 11 is a resolution authorizing an amendment to the contract with Frank L. Bloom Construction Company to establish the guaranteed maximum price for the demolition phase of the Callidium project. And if I could ask Damon to give you kind of an update on the project fairly quickly. I'd received a couple of questions really about, hey, how much money has the museum raised, and sort of where are we in this project, and kind of, what's next. So Damon, if you're there, if you can kind of give a quick update. Thank you.
Thank you, Mr. Manager, Chair and Commissioners. So demolition, assuming that this item goes through, is slated to begin in May and would conclude by August. Around the same time that demolition starts, the design documents are anticipated to be completed in May, to be followed thereafter by the construction documents in October, and then a guaranteed maximum price is anticipated to be provided by Frank L. Bloom in December. If that schedule is adhered to, then in 2021, around the beginning of the year, they would mobilize and begin construction, weather permitting. And then the construction process is supposed to last about 21 months. So that would end in winter of 2022, thereabouts. As far as their fundraising goes, I got an email today from Elizabeth Dampier, the executive director at Palladium, and she noted that they've raised $8.77 million, and that they have probably another $800,000 that are in the works toward their $10 million commitment for the exhibit development and implementation.
Any questions for Damon? Okay, very good. Thank you, Damon. All right, the last items are items 12 and 13, and 14 are resolutions approving or denying refunds as recommended by the tax assessor or the collector, and you can see the amounts there. And then you've got some reports just for acceptance by the board, the March contribution-based benefit report and a change order report. And then the final item, which I'll turn over to our county attorney, Gordon Watkins, involves the appointments to the Equalization Review Board. So, Gordon, did you want to introduce that and make comments?
Sure. I hope everybody's doing well. I just wanted to give you an update on that. We briefly discussed it. It was brought up last week about the Board of Equalization and Review. And do you remember what happened was we had our automated system that takes applications for the board had a hiccup in it, and the chairman, Mr. Davis, his application did not make it through to the clerk, and so he was not included on the March 19th vote when you voted on the Board of Equalization and Review. After that meeting, I was able to do a little bit more research, and I discovered a 1965 local act passed by the General Assembly for Forsyth County, which established the Board of Equalization and Review here. The salient point there is that it mentioned that the board shall consist of 5 members. So that does not give us the leeway to expand it to 6 that had been proposed last week. That's the bad news. The good news is that the board members have not been sworn in. And so what is being proposed is that you have in effect, a re-vote on the board, which would be next week, and you would have before you all of the proper applicants, which would include the 5 incumbents plus the 1 citizen wishing to serve. And so you would, there would be a motion to reconsider, and you would set aside last month's vote and then re-vote on the board. And they're currently scheduled to be sworn in at the end of this month, so that would not interfere with their work at all. I'll be happy to take any questions.
Okay, if there are none, Mr. Chairman, that's all that we have from the staff perspective for the briefing today, and I'll turn it back over to you to for any other discussion and to go ahead and adjourn.
Okay, thank you, Dudley. Any further comments by members of the board before we adjourn? If not, Commissioner Kaplan is with us by telephone today. He's had some problems with his equipment, but good to have Ted with us, and he's made a motion that we adjourn. I'll second that motion. All in favor, say aye. Aye. Opposed? Adjourn.